This user testing is actually one of the phases and in human-centered design approaches. Human-centered design, that is, we call it ACD, is kind of an innovative process where social and behavior change team uses to be able to design interventions to reflect the needs, aspirations, cultural views of community members. We invited stakeholders together, that is community leaders, parents, adolescents themselves, because they are end users, as well as what health service providers, to a central location, and we did what we call co-creation, where we co-created ideas and identify an intervention pathways, where we identify one, how community leaders can be involved, two, how do we strengthen the relationship between parents and their adolescents, then three, how do we develop packages to enhance the relationship between health service providers and adolescents. So in doing this, we identified three key interventions. One is the community-based interventions, two is the parent-based interventions, and three is health service providers intervention. So in this phase that we call the user testing. So having identified what we call prototypes, that is basically the intervention pathways, we have put these ideas together through the co-creation process. We put these ideas together and we have come back to communities to have these user testing sites, such that the prototypes that we develop, remember they are rough ideas, that we have now brought them back to the community. We are having focus group discussions with community health service providers. We are having focus group discussions with parents. We are having focus group discussions with adolescents themselves to reflect the three key packages: adolescent package, community package, and that of the health service package, to see how these ideas can be put into life by testing them, gathering their insight, try to identify how possible we can make these interventions a reality.
The previous phase of this project, we came into these same communities and we interviewed adolescents, we interviewed their parents, the teachers, community members on how we can make the access to these health services better for adolescents. So there were several barriers that we identified, one being that the communication between adolescents and their parents was lacking. So we have now developed, with the information we received, we developed some prototypes that we are now coming back into the field to test them out and see how well they will be able to be implemented in these communities.
This research activity uses the behavioral design process, and specifically the human-centered design approach. And so far, the behavioral barriers that are emanating from the research findings more or less include the fact that parents are not communicating effectively with their adolescent children, the fact that adolescent girls are fending for themselves and as a result get these kind of unintended pregnancies along the way. And then also we have one key finding which indicates that health workers are not providing confidential and respectful sexual health, reproductive health services to adolescents, and hence, of course, including their mental health related services, and thereby resulting in some of these incidences that we are observing in the various communities.
All of us as organization, we aspire to develop user guides for adolescent health development and their mental well-being. However, the challenge has been that we always develop tools that are not usable or acceptable to the group that we are developing the tools for. This time around, the adolescents, their parents, and health care providers are part of the user testing preparation, the testing of the tools, to see how new ideas, new opinions, new guides could come out of it. The adolescents who are participating in this testing process have shown it already that using tools which comes in the form of games, to play the game, come out with questions. The answers that come out of the questions are actually educative, which is giving them that opportunity to take options out of it.
This user testing is actually to help us come out with kind of fidelity interventions. That is, interventions that really reflect the needs of community members. Then we use these interventions to do what we call the rollouts, where we implement it across this pilot district to see how it's going to work and contribute to achieving our goal of making sure that adolescents are able to get access services without any barriers and also have their mental well-being improved.
Using focus group discussions and role-playing, we're trying to test out several different things with the prototypes that we develop. We want to understand if they can be used in a local context. We want to know if they will be easy for people to use, easy for them to follow, and maybe even teach others how to use the prototypes. We want to make sure that they have fun and enjoy using the prototypes that we developed. We also want to make sure that they're able to comprehend, they can understand the reason behind these solutions to the barriers that we identify.
So we have the parents package, which actually involves that kind of interaction with their adolescents, just to unearth some of the key communication issues that will enhance effective communication with parents at the end. So we have some board games and stuff like that that we are testing to understand how effective they will be at the community level.
So what UNICEF plans to do is to support Ghana Health Service in rolling out these prototypes with health workers, with parents, with adolescents, so that we can try to see an uptake in adolescents actually going and seeking out these health services.
We are collaborating very effectively with the Ghana Health Service, that is the Adolescent Health Program. So in terms of even identifying the pilot district, the Ghana Health Service led that based on their data and some ongoing adolescent initiatives that they have in Asante Achim South and that of Abdensi South.
The district, for instance, in 2020-2021, our adolescent or teenage pregnancy was around 18.4. With the support from UNICEF, 2022, we were able to reduce it to 17.4. Meaning at least 1% of the burden has been reduced. We are expecting that with this introduction of the user testing project and the designs that we are going to put in place, we'll be able to reduce it significantly from maybe the 17.4 to 12 or even lower than that. That is what we are expecting within the communities. And we want to happen that then we can say, oh, Ghana Health Service, we are doing well. UNICEF is helping us, and we are achieving the best for our adolescents in Ghana Health Service and in the Adolescent South District.
UNICEF, dear, service, we are seeing for na new more a dorsal, for education, for health, we saw more year who you be brave. Now, you also so research work on more near the aboa, and we are so. And there may be an enquino, and I'm UNICEF so, and my name may be S. And to me, born basso. Now, mistress, it may be our challenges, womb, and to a basso more faces challenges be a send a TB almost said you more far to almost so more yet, non-tino, and now banessa. No more coswa, and I'm just say near Rade form so and so be shra, and my via self on any.
Ya were Mabunuku, Brano Brano, Yesia. Iwa yeshia sorry bo so yeshia wo baby ayeye dwumedia na yedi emabunu apomuden ne omo ha ho nkomo nti eno nanam kwan eno ne kwan menam so a medi hu mabunu na nya amade yedwumedia.
The first group that we met was supposed to be parents. Then the challenge we faced was that the mobilization was very good, but there was a challenge in terms of getting younger parents. That is because, remember, this approach is supposed to strengthen the bond between parents and their adolescents.
One of our major challenges in Atribwana and 18 territories is teenage pregnancy and school dropouts. And with these two, it can help us to solve it, because when the adolescent comes and opens out what is in their mind to you, we can use it to address the issue of the adolescent.
In my district, Asante Achem South, we find it very difficult when it comes to speaking with the adolescent on sexual health. This is because culturally it is abominable some way. So it brings about the teenage pregnancy and all sorts. So I think this program will actually help us as health workers to communicate with the parents, and then through that the adolescents will also focus on their studies.
If you tend to choose any place at all to talk to your adolescents about sexual issues, the adolescents might not give you the required responses.
We are here to interact with health workers to find out about their input into the tools. So in the process of doing that, so we have 4 health workers and 6 adolescents, and we have 2 sections now. So one section has 3 adolescents and 2 health workers, and the other section to have the same number of people. So the interaction is ongoing. We want to find out about their inputs into the tool, to make sure the appropriateness of the tool to be used to bridge the gap, the communication gap between health service providers and adolescents. And that is what we are doing.
In all, if you work together with adolescents and then the parents, it will help keep the teenage pregnancy and all other menace, which is bringing the name of Asante Achem South down.
We took them through this setting a SMART goal. We looked at the meaning of SMART being specific, being measurable, being achievable, relevant, and time-bound.
So, go and set mama say in the examination, me di first to class. And now me go and set and say, me also a di first or class. And now, a choir me first a di first or class and say, me also a swing dear. Me swing dear. Send a bear, a me di first work. I dear a bit me see me kwama, mint me achieve me go, yare. And I feel so obre. Say me a juma a broma hoarding swa. Even my bread basana mint me swing.
Me your church need to know me shem kwala be brace winty we are mamma quanya meet me more fry youth no and teenagers no man and man dim como. Me who say o mamma frane ben no more ya now for or mo can be beer chiro. You will be so mubiano. Or more fan to tell, can be beer tunes, witty me who dear how warm, and I dear or more personal monso a year, instead no name messia I found.
The tools and tales match, it has its emojis and things you know about the adolescent when it comes to your facility. It helps, as in when you go to the thumb side, you have 5 fingers. It shows, everyone shows what the person is. If he's happy, you use the, and if he's annoying and angry. So if you use the tool, it helps you to know the state the person is in. So with the state and what you asked, you can use to address some of the teenage pregnancies and the school dropouts in our community.
Once again, see any parents neighbor. I used to lose no. Say any parents boss our games na my need and carbon. Like you need say, you bet me I express all feelings and I say if something is bothering you, bet me express such a parents. Games near boy near in our boy, my it's many out for a dune comma, young ferry and I say,
During the testing period, they gave their inputs as to what we could, do and what other actions that we could infuse into the tools, which will make it really funny, interesting, and most importantly, educative.
I think UNICEF should build up with this testing and then expand the program to other districts and then other facilities so that they will also gain the knowledge, and it will help the adolescent to also keep those menaces, and it will build up the relationship between the parents and then the adolescent. And then if they are having any challenge, they will be able to come out with their challenge, and then appropriate solutions will be given to them from their parents and then the health workers as well.
Many adolescents shared their insights with me as I interacted with them one-on-one. They were very happy that we did this testing together with the health workers, the parents, and also the community leaders.
Say my best friend de kakrai. Sibe me who say my colleague be and I'm an be a course out to be anymore. Met me at church and or quite over fast to be free to be any. A business say on any man and any papa no a becasa afa you all facey. I want a challenge Simono. Not a more be around the abuano. A more better media buan kakra met me a car for me.
I've been able to gather that when we come in contact with the parents, we are able to, because of, especially with the SMS prompts, we'll be able to know when and how to speak with the adolescent when it comes to their sexual and then their mental health. So when the prompts comes in, I think that has really helped us to know about it. It guides us in a way that will help us to communicate with the adolescent when it comes to their mental health. So I think the SMS prompt and then the games which was introduced with the questions attached to it, I think it really helps.
The mabes any the almost 30 year me there was a yetwaso a beboa yim bebre a beboa ofo a beboa mofra no bebre.
This kind of lesson I've learned today will help me a lot to impact it on adolescents in this community to overcome some problems they have about thinking and the attitude they are in. Sometimes somebody will have a problem and you don't know how to share the problem with somebody, even their parents. So if I'm able to learn this, I'll help those kids. Whenever they have their problem, I'll sit with them, then give them advice.
Never much ama many agena me who say that you me. I'm
really excited because this too is going to help us make our work easier and more easier, and also make our relation with the adolescents very easy.
No matter the in the doors, say now like bufu na a show so na say me a wompa. It's me echo outside cause echo share nyoma na ma bufu na no perform. And I say, being so I had dear manasho. Maybe intimate can't show be not say, wow, sorry, idea. Wait me a page out and sorry. Now, I come on what to know day. Once that now was so the course rana walk on not to. So I come on to not saw the bath for ma. Now I j what bow one na Fremana Barbo and think. Idea Monsieur or winning in adolescent child.
It helped me a lot with regards to going back to recall what I had learned and the things I had to do. Just looking on the tool, you would know what to do at that instant, and then it will come situations before you take the necessary actions. So I think that is a great tool.
With the knowledge gained from the testing, I think this tool is going to actually help us, because with the adolescents, we are not going to be judgmental towards them, because initially when an adolescent comes for those services, we frown at them as the society also frowns at them.
Remember, when you are bringing an intervention, the intervention should not hassle the people. It should reflect what their aspirations, what they can do within their limited resources without having to bring external resources. So this user testing is to achieve that particular goal by ensuring how we can increase access to adolescent services and also promote adolescent health well-being, mental health well-being, yes.